or something. Yeah. Oh, what's that?
Okay, so this is, I mean, and this is again is how far things are progressing here. This is one of my patients about 8 years ago, and this is what he was taking every day. So this is, in the morning he was taking this, in the morning, then mid-morning, and then in the afternoon, and then in the evening, and he couldn't eat with this pills and these pills here. So he was taking this whole set of drugs. So,
and not only were there more of them, but they probably had slightly more toxic side effects then, did they?
They did, and what we're now moving to, so if we look here, is back in 1996, the daily pill burden maybe being 10 pills 3 times a day.
Yes.
So, and we're now moving to things that are getting easier and easier. And 2007 should see the launch of a 1 pill once a day. 1 pill once a day.
That's an amazing achievement. So, of course, one of the things people say when you speak to them who are on ART of some kind is they say, well, of course, this is the rest of my life. I'm going to be taking these pills.
Yes.
And one's going to say, in a field of medicine like this, with the exponential growth of knowledge and techniques, it's pretty impossible to say for the rest of my life. I mean, who knows what's in 10 years' time this picture will look so old-fashioned to you, presumably.
Yeah. Let me have a look.
But it's wonderful, though, isn't it?
I mean, this is what the future's holding. 2007, and here we have, if you like, the first of a new breed of drug called the integrase inhibitors, and then we have CCR5 inhibitors. So things are developing all the time. I think that the difficulty is, and what I don't want to do, and this is always the danger. You say, look what wonderful drugs we've got here, and how easy it is to treat them. Well, that is really not the case. You know, you don't want HIV. It still kills people. The side effects from these drugs can be very severe. When we talked to Hilda earlier, she was extremely sick, and probably as a consequence of the side effect of her drugs.
In fact, the side effect was doing quite the opposite of what it's supposed to do. It was actually stopping
suppressing her CD4.
Yeah.
So it's a very difficult balance.
It also might give people the idea that AIDS is no longer a threat, and that HIV, therefore, is not something to be worried about avoiding exposure to.
Exactly.
Because look at this, I'll just take 1 pill a day. Heaven's sake, that's worth it for a bit of free bareback nookie, you know. I guess people have that attitude, but
I think that certainly some of the younger people at the moment on the gay scene, particularly, perhaps aren't as scared of HIV as they perhaps should be. And I think it's some of the older generation who do remember their friends dying.
As I do, indeed, yes.
And I think that is a problem. I think it's education. Coming back to that, you know, the sex education campaigns, safe sex education campaigns, they're not really getting through.
Yeah.
And also, you know, it's we've got to try and encourage people to look after their sexual health more, to attend sexual health clinics, to say, well, actually, it's okay. I'm being sensible. I'm
going to ask you a question I've not asked anybody, and it just sort of popped into my head, really, out of interest, and that is...
Oh, that's worrying.
Yeah, well, it's a small thing, but, well, as it were, a small thing. A huge amount of incredible, groundbreaking science at the very forefront of our understanding of cellular structure and DNA has gone into the creation of these generations of antiretroviral drugs. We're still saying the only way to stop yourself getting it just about is a latex rubber johnny, a condom, which hasn't changed since the lambskin ones of the 14th century, and indeed the Roman ones. In other words, I just wondered if there was any human expertise going into prophylaxis rather than treatment.
There is for sure.